Hi, I'm Dr. Erin, Lucie. Welcome.
Micah, Lucie.
That was funny.
Was that intentional?
No.
Oh man, I really.
I was going to say welcome. Okay, did
I
I
thought
say
we were-
welcome to episode 2?
Well, I thought you were going to say, hi, I'm Dr. Erin, Lucie. Hi, I'm Micah, Lucie.
Okay. Hi, I'm Dr. Erin, Lucie.
And I'm Micah, Lucie.
Welcome to episode 2 of our podcast.
And today we actually want to focus on the connection between aesthetics and longevity. For a lot of people think of aesthetics as Botox and just taking care of wrinkles and making their skin look good. But surprisingly, or maybe unsurprisingly, the connection between skin and what's going on inside is huge. It's a massive piece of what's going on. So you want to dive into that a little bit?
I think one of the biggest things with skin health and longevity is really just like looking at the skin and seeing the changes from a child and an adult. So when I look at my babies at their skin, they still have nasal folds, they still have under eyes, they can have little dots under their eyes. But what we don't see is we don't see pores, we don't see lines, expression lines or lines with movement. And then we don't see brown spots, acne, rosacea. Those things tend to happen when we start to age. And those are the things that we look at. Like I talk about tone, texture, volume loss. What are we seeing in adults that we don't see in children? And how are we going to make your skin healthier and your body healthier? And I think that your skin is it's the largest organ that you have, and it is a reflection of what happens on the inside of your body. So if we're seeing inflammation on the outside, like acne, rosacea, brown spots, we're going to be seeing inflammation on the inside. You can just assume that there's inflammation starting here, almost like rust on the inside of your body.
Yeah, because if you think about our bodies are completely made of cells, and your cells have the DNA inside, they have your mitochondria, they have all these things that are doing a trillion operations for you on a daily basis. We don't think about that our body is really operating on its own. Its goal is to keep us around, help us survive. And when it comes to cells, the healthier your cells are, the better you're going to age. I think a lot of people have this connection to the number that they are. Well, I'm 65 years old. Well, I need to start feeling knee pain now. It's like, no, the number doesn't really mean anything. It's how well have you taken care of yourself. Even for I was thinking about my high school graduation. I see some people in there that I went to high school with. I'm not naming names. I can do that.
Don't name names.
But I'm like, man, they look like they are like 20 years older than me, but they're the same age as me. And I'm not trying to brag, but I understand that, life is hard. Things come at us in life, but it's the way that we kind of run our habits, our lifestyle, the way we take care of ourselves is huge, setting us up for success. And it really, like you talked about, ties with the skin.
Yes. So when somebody comes in for a consultation, normally the first thing that somebody wants done is Botox. And the reason I always say like Botox is a Band-Aid, and for those of you that don't know what Botox is, it's a cosmetic procedure. It's a medical procedure, but Botox is a neuromodulator, and it basically helps to decrease muscle movement. So it's actually botulinum toxin type A, and it is a poison that we put into the muscle and causes it to relax and not contract. And what that's doing is it's giving your skin basically a chance to grow and heal and repair itself. It's almost like putting the muscle underneath to sleep, and then the skin on top can regrow, and you're just giving it time to regrow and repair. So if somebody comes in and they want to do Botox, that means that their skin is definitely aging. They're seeing those fine lines, which means that your collagen's going down, your elastin's going down. It's not able to bounce back. And what we want to do is really kind of get to that root cause of, yes, you're aging, and I look at the patient and see, okay, they say they're 35, but they look 45, or they say they're, 55 and they look 45. What are the differences between what's happening with these patients? And since we've been doing this for so long, like over 20 years, we kind of have a better idea of what's going on and the differences that they've made in their daily routines and their daily lives and their daily habits in order to have these kind of outcomes happen. But when a patient asks for Botox, we're looking at what can we do, and like what is really the concern? Like, why are we seeing these signs of aging? Maybe somebody that's like what I would consider premature aging. and what we call inflammation or inflammaging, where you have that inflammation that is creating the aging at an accelerated rate. I don't know. Have you heard the word inflammaging?
I've heard that term. I forgot about that
me?
term. Yeah. Inflammaging.
It's
Yeah.
one of my favorite things because it really is true. Like, like the quicker that your body creates inflammation, like the worse, because inflammation is basically, it's just like rust on the body, or it's just creating an inflammatory process. And then you have a harder time healing and repairing. And then when inflammation is there, now we're more likely going to get those disease processes happening, like diabetes, heart disease, arthritis, all of these processes, even if they're genetic, like rosacea is definitely a genetic disorder, but we can control it through several different things we can talk about, but we want to control the inflammation. So what are some things that you do with testing that help us with aging
A
or
lot of different
inflammation?
ways. So even, kind of talking to that oxidative stress or the rust piece, which is really what that is, we actually test for a marker called 8-OHDG, and it's looking at damage to the DNA in the cells. So you think about your cells, they're replicating all the time. I think it's 72 hours, all of your cells have essentially replicated. But you think about if you made a copy of a copy, unlike your printer, it doesn't look as good. Make another copy of that, it doesn't look as good. So what's happening is those cells that are damaged from stress, from that rust that you're talking about, that DNA is damaged and it's replicating itself over and over and over again. And that goes to your whole body. Your entire body is made of cells. So that's just one of the markers. And then talking about from a gut perspective, to me, the gut is one of the biggest things that we can manipulate to improve on and strengthen that will help the skin. Because the skin is really kind of this alarm system for us, like, oh, I've got this acne, I've got rosacea, which I know is genetic, but the flare-ups from that, the skin is really telling us what's going on the inside. So looking for those signs, it's not just about, oh, I just need to get rid of these wrinkles, I just need to get rid of these brown spots, I'll be good. It's like, no, there's things going on inside of you, especially in the gut, that are telling us a lot.
I think if you hear this frequently, like if you look at a president at the beginning of their term and then at the end of their term, like how drastically they have physically aged just from like all the stress and probably lack of sleep that they're getting, because stress is something that's in our environment today that, I mean, probably was maybe not as stressful as before, but we have these constant things like cell phones and emails, and we just have more things happening that are constantly using our brain space than previous times.
Yeah, because stress, you think about, we have this kind of ancestral wiring in us. You think back to like caveman times, the biggest stressor somebody would face are like, oh, is this saber-toothed tiger going to come eat me today? Or like, I need to find food. I need to get out and find shelter from this weather. But our stress wiring is something that's there for our survival. It's all about trying to keep us, alive for as long as possible. But the problem is when you have physical stress, maybe like a lingering injury, as far as like maybe like lower back pain. If you have emotional stress, if you're in a relationship that's traumatizing, or if you're stressed at work, you're working 8 hours a week, all that stress, the brain and body look at it the same way. And every time you face a stress, the body has to make a choice. It's either going to focus on handling that stress to keep you alive, or it could focus on rebuilding you and restoring you. But it can never get into that restore space as long as you're stressed. Always has to make that choice above all. So when it comes to the skin, you see that. The stresses of life. It's not just about being in the sun. It's about life itself, putting that stress on us, and you see it. You can just see it in the skin.
Mm-hmm. One of the things that, like when patients come in and they want to do a treatment, like I said, normally it's Botox, but we always ask them their why and what is happening and why are they coming in? What is their journey and how can we take this journey with them? I remember a patient, she came in and she was actually, we were talking about stress. So I was thinking she was having domestic violence and physical abuse, and she did not look good. And that's she didn't feel good about herself and she was out of this relationship. So you could tell that she was happy and she was proud of herself for making that decision to leave this bad relationship. And she had said, I want to get rid of these lines right here on my forehead because they reminded her of the time when she was locked in her closet and she was crying and frowning. And so that was like the very last thing for her to get rid of in that kind of emotional healing aspect, was physically getting rid of those lines so she didn't have that constant reminder of what was happening.
Yeah, and I think that's for sure. I mean, I think a lot of people get tied up on, oh, well, you're trying to get this look. It's like, no, you're trying to get confidence back so that you can go live the life that you need to be living. If you look in the mirror and you like what you see, it changes everything. If you look at yourself, you're like, oh, my body's not how I want it. My skin looks bad. I look tired. It's going to infiltrate everything you do for your entire life.
Yeah, I used to tell I have a younger sister, and my advice to her before she took an exam would be get up, take a shower, put your makeup on, go in like looking your best, because it's going to give you that confidence to really perform your best. And research shows that women that wear lipstick make more money than women that don't wear lipstick. Or women that wear high heels make more money than women that don't wear high heels. And it's just, not that high heels do anything or lipstick does anything, but it might give you like that boost. I should probably put lipstick on today.
No, you look great.
They might give you that boost to have that extra confidence or that persona of this is like, you're just able to portray that better because you feel better. Like you look good and you're going to feel good.
Well, and that also really ties to the gut as well, which, the gut is connected to the brain in such a major way. So you think about serotonin, your neurotransmitters, all these things are synthesized and started in the gut. So if your gut's out of balance, it's going to affect your dopamine, the way you feel, your mood. All these things are massively affected by what's going on inside. Mm-hmm. For sure. Okay, we'll keep going. We're going to be done. We'll just have our little break. Okay, we're good. So, I think one of the biggest areas that really affects skin is stress. And we've kind of touched on this. Stress is something we can actually measure. Surprisingly, there's a hormone called cortisol, which is the stress hormone. In your body, interestingly enough, we're actually diurnal creatures, which diurnal means that we follow a pattern of day and night. And our hormones, the way we operate, follows that pattern as well. So for example, with cortisol, the stress hormone, it rises when you first wake up because it wants to raise blood sugar, get you energy, get you focused for the day. As you go through the day, that curve drops down to its lowest amount, allowing melatonin and other things to come into play to help you rest and get deep sleep. But if you're always under stress, that cortisol never drops off. It's kind of like a car. Like if you just drove through the streets and you just mashed the gas pedal down without ever having a brake, I mean, the car is going to blow up. You're going to get in a wreck. One of those two things is going to happen, or you run out of gas.
Right.
But that's essentially what's happening with stress, is that you're pushing the gas pedal down all the time. And there's only so much you can do with that.
And running out of gas is what they call adrenal fatigue, right? So that cortisol looks like a curve, like a big bell where your cortisol is higher and then that's lower. And that's what we see on the labs whenever we do a cortisol test. We can do a blood test, like a blood where we actually draw your blood, or we do a blood spot or a saliva test, but that only gives us one reading. And the best way is to do a 4-point cortisol where we're actually taking your cortisol levels and we see them throughout the day and exactly where they are. But the problem with the cortisol being elevated, if we're looking at the chain of events of what's happening with your hormones, you have your cortisol, your progesterone, your testosterone, then your estrogen, and they're kind of all in a line. So if your cortisol is taking all of this stress and all this hormones, then it takes the hormones from these areas. So your hormones are made from sterols or oils, or cholesterol,
B vitamins.
And if you don't, the cortisol will just basically start taking everything from your other hormones, and then your other hormones will go down and they suffer. So then the rest of your body is suffering while your cortisol is elevated. And the problem with elevated cortisol is it leads to increased insulin, weight gain, diabetes, increased waist circumference, your blood sugar gets kind of crazy, your cravings get all over the place, then your weight will typically start to go up. And then you can't sleep at night. We call this wired but tired, where your cortisol should be low, but it's actually high. And so you can't shut your brain off. Even though you're tired and you're exhausted, your cortisol tends to be elevated.
Yeah, because then what happens then is a lot of people turn to prescriptions, they turn to over-the-counter supplements, they even turn to things like alcohol. And the problem with that is it just messes things up further. So you think about alcohol, for example, if you're like, oh, I just need a couple of glasses of wine before I go to bed. That wine is full of sugar. So what happens is it raises your blood sugar. You get in bed, your body has that blood sugar drop off. It kind of freaks out to raise that blood sugar again. So it's using cortisol to do that while you're sleeping. So you actually never get to enter REM sleep. You never get that deep level of sleep that's going to help you feel restored when you wake up. And you're like, what is this? So when you wake up, you start to pound the coffee again. You start to do all these things trying to combat that fatigue, when simply what needs to happen is we just need to mitigate the stress. And, when it comes to stress too, I think a lot of people think, well, I can just take all the stress out of my life. It's not possible today.
Yeah.
The way I kind of look at it is like if you're in the ocean, we want to help you manage the waves. You're never going to fully remove stress. We live in a time that's just not possible. But there's a lot of choices, a lot of habits you can do now to really make a difference.
Mm-hmm. Like, what is your stress response going to be? Aside from the cortisol level testing, I like to use the glycan age testing, and that tells us your chronological age versus your biological age. So we know your chronological age is how old you are right now from your birthday. And then your biological age is how your body thinks or how it feels it's responding. And so this is a blood spot test, right? It's blood spot. And it looks at the glycans, and glycans are like sugar, kind of like sugary substances that create almost like a rust within your cells, and it delays the process or how quickly your cells respond to things. So the glycan age testing can tell us what your age is, kind of like on paper, like how your body is responding to things. And that's a better indicator than there's a lab called HSCRP, which tells us kind of an acute injury, like, are you having inflammation right now? But we can use the glycan age testing to show, okay, your body is like, everything looks okay with traditional standard labs, but the glycan age testing can tell us how your cells are really responding to stress and the aging process. They used to measure telomeres, and telomeres replicate, like you were talking about replicating and duplicating. So telomeres, they used to measure those, but now I think there's a better test with the glycan age.
Yeah, and that's the thing people need to understand too about aging. It's not something, your body's super resilient. It has a long kind of like shelf life of combating stress, combating these things that are happening. So when you see an age, like, for example, if like, well, I'm 45, but my glycan age said I'm 70, that tells us this has been happening for a long time. It's not something that just happens overnight, which is why I like that test. And I think it's fun too for couples to do that test. Like, well, I'm going to be younger than you. Like, no, you're not.
I'm younger than him.
Whatever. It's true. I'll blame my cardiac arrest
Yeah, he basically
journey
did.
for that. But yeah, so it's just important. It just opens the door to someone to like understand it's time to make changes now.
Yeah.
So, yeah.
Talking about like one of the first things that we see our patients ask for is Botox. And then we look at all these other things because Botox isn't for everybody. I have a whole article, like a blog I call it Botox as a Band-Aid. And sometimes that's probably bad marketing for a Botox clinic, but we are more than a Botox clinic. There's so much that needs to happen. If you think that you need Botox, like, they have an amazing branding. The people that made Botox have amazing branding, and they put it in your mind. If you have wrinkles, you need Botox, but that's really not the case. If you have wrinkles, you need probably chemical peels, microneedling, gut health, supplements.
Yeah.
And then things that are probably DNA repair enzymes for the outside of your skin and the inside of your body, because we want to try to prevent all of this, like the entire aging process. And when I did my doctorates, my thesis was on metabolic health and It was all on prevention. Like, how can we prevent heart disease from happening? How can we prevent diabetes from happening? How do we prevent your hormones from going down? Now we have things like peptides. I think that's what's amazing about being in the business for so long. You see things that were never done before. Like, we finally have things that can really increase collagen and really heal the gut from inside, and amazing medicines and peptides and all kinds of things that we didn't have, 5, 10, 15, 20 years ago.
Yeah, and that's really where I think it was amazing about, being where we are with the aesthetics world, because now functional medicine, now all that stuff is becoming the next thing that's going to be the next big wave. So for us, we're trying to get ahead of that to really serve our clients at a different level. Because, think about, I've mentioned this before about my mom passing away from cancer. Cancer isn't always avoidable, but if you look at the amount of deaths that are happening, especially in the United States, essentially 6 out of 10 are deaths that could have possibly been prevented. They're diseases that didn't have to happen. So we're trying to save lives here, save families. With my cardiac arrest, if I hadn't, obviously that's not something I could stop. I was born with that, but the lifestyle things I did around that made a huge difference. And to think about not being here for my 4 little kids, they wouldn't have had a dad. That's something I don't want for anybody else to have to go through, for sure.
Mm-hmm. And I think that with our clients, what we're really trying to build is we used to just keep our aesthetic side on one side, and then I would see my hormones and my weight loss patients, and Micah would see his functional nutrition patients, and we kind of kept it as 2 separate clinics for a long time. And then it got to the point where I would have an aesthetic patient, and they, we would talk to them, and they would say, oh, I have like heartburn that's going on. And once we really got into why they were doing things and really what was happening with their health, and we changed our intake questionnaire, we could see that things that were happening on the outside were still, like, things were happening on the inside as well. And we couldn't ignore the fact anymore that we would just see them for Botox or just for chemical peels or microneedling or laser resurfacing. And then once we combine the two together, those patients, like, they all get free functional nutrition consults now, and we're able to run their labs before we start treatments. And now that we've combined those together, patients are getting like the best results because they're actually like making their cells healthier from the inside. Because if I want to do a big resurfacing laser and a skin tightening treatment, but their cells are not, they don't have enough energy in them. Like, they don't have enough energy because they have leaky gut, or they don't have any hormones, then they're not going to get good aesthetic results if we can't treat and get like the inside totally optimized.
Well, even surgeries in general, that's something you can actually work to reduce someone's inflammation, change enough lifestyle habits. Say, I've got this major surgery in 2 months. Well, guess what? Let's start working now, so that you are as healthy as possible when that surgery comes, so that you can have the best chance of recovery and the best results. And I think a lot of people, especially when it comes to testing, they're kind of like scared to test. Like, well, I don't want to know what's going on. But it's like, knowledge is power.
Yeah.
So the fact that you can know what's going on gives you a chance to do something about it. So that's what I really encourage everybody to do. Anybody I talk to is like, let's get tested. Let's find out what's going on now, so you don't have these things come down the line that you were never prepared for.
Mm-hmm. And we can see this almost immediately. We were talking about PRP earlier. If I have a patient that wants to do a PRP, we're not just drawing PRP on them that day. Like, they have to go home. They need to eat basically vegan for a couple weeks.
You want to tell them what PRP is?
Oh yeah. PRP is platelet rich plasma. And that's where we take your blood, we draw it out, we spin it down, and then we re-inject it into the face or other areas. There's lots of other areas we can inject it, but we'll just stick to the face for now. And there's 2 ways that we process it. Actually, we used to use it as a liquid underneath the skin and just create like a fertilizer, or we can heat it up and then cool it back down and we turn it into a gel. So we're actually using it in these areas for volumization and filler, as opposed to using traditional filler. My favorite area is under the eyes. But the benefit of PRP is that it has your stem cells in it, like your own natural stem cells. And so we are regrowing the skin underneath, we're regrowing the fat, we're regrowing the tissue. And so we're not just putting in like a gel filler, it's actually your own tissue that's going underneath. Now, that said, if you are not healthy or you have uncontrolled diabetes, you're not a candidate for PRP. We have to make sure that your blood is totally healthy, because the stem cells aren't going to be healthy that we're injecting into the face, right? So we put you on a very specific diet before you have this treatment done, so that you're getting the most out of your money and the absolute best results possible.
And that's really the thing too that I love about like the PRP and other things that we provide for clients, is that we're trying to make it so the body understands what we're doing. There's so many synthetic products out there, different things that are used, that the body is like, I don't know what this is. I can't use this at all. So, I mean, it's using things that match with your body's coding. So important.
Yeah. So for example, he's talking about when your body says, I don't know what's happening. There are fillers, like I was talking about, the filler has been around for a long time. So that filler that came out, 20 years ago, it is still out now, and you can inject it. We don't inject it here at the office, but you could have, because of the way that it's formulated, filler is hyaluronic acid. So hyaluronic acid is a particle that holds 1,000 times its own weight in water, and it plumps up. So it feels like a little gel, like a gel consistency Jell-O. But the way that they have to hold it together is like a lattice framework, and every company has their different lattice framework. And you can create sensitivities because that framework is not native to us. You can create sensitivities, or not an allergic reaction because that would happen immediately, but sensitivity to it years later down the road, because the filler stays in your face for a long time.
And remember, I mentioned stress. That's another stress point. So, I mean, you have more stress coming into your body that your body has to deal with on top of everything else. So, yeah, super important.
I feel like I've been very hateful towards filler the past couple episodes, but I love filler. And actually, if you ask me what my favorite treatment is to do, it is filler, because I am an artist and I love injecting filler. But you have to put it, it's kind of like right tool in your tool belt for the right person. So it's great for the lips, maybe like chin, jawline, cheeks, but there are better things and more options to filler. It's not just like a quick fix. There's so many different types and brands, and so many options when it comes to filler.
Well, and because you think about right now the rise in like GLP-1s, there's different products for that. You're going to have this volume loss as you lose weight, which is great. Things like filler can kind of help restore some of that natural look to support that as well.
Yeah. But really, ultimately, I think it comes down to like how, if you start to think, oh, I am looking in the mirror and I'm like not looking great, or I don't feel good, or I feel tired, the very best thing that you can do is obviously get a consultation and get tested and see what is your biological age, what's going on with your gut, and then kind of go from there.
Yeah, because the gut is everything. And like we said at the beginning, the skin, what you see happening on your skin is really just that side effect, that symptom telling you the alarm of what's going on inside.
A window
to the inside. Yeah, for sure. Okay, I think that's all we got.
That's all we have for today on skincare and longevity. Join us next time for Micah's input on weight loss. I'm Dr. Erin Lucie.
I'm Micah Lucie. Thanks for being here.